Hi, I'm Dr. Loretta Stamba, and this is a video blog on what to expect at your well child checkups. The first thing I want to mention is that it's really vital for kids to have checkups on a regular basis, mainly every year or sooner if there are chronic illnesses such as asthma or ADHD, or if a child is taking a maintenance medication of some kind. We need to sort of keep up on their growth parameters and how they're doing, depending on the issue. So just be sure to speak with your pediatrician and find out what their recommendations are. The first one we'll start with is newborns. One of my favorite, and I think it's kind of an involved visit, especially if it's a first-time parent, but I love them because it's an innocence that we all go through, and it's a nervousness and anxiety that we all feel when we first have our child home from the hospital, and there's so much to do, and one of the things is to come visit us. So we hope to make it a little bit less stressful and answer questions that anybody may have at those visits. The dads are an integral part of those visits. Of course, the mamas are too. Oftentimes there are some issues with breastfeeding or a lot of conversation about latching and things like that. But we don't want to forget the dads because they play a big support role, and it's important for dads to bond with their babies too. So at a newborn visit, aside from talking about concerns, we will also check growth. We expect that the babies will lose a little bit of weight, but we allow for some of that, and then decide whether we need to track the weight a little more closely, or have like a standard 2-week checkup back with us. We'll measure the baby. We will measure their head and their weight and their length. We will talk about feedings and talk about stooling patterns and talk about safety, things that you can do to keep your baby safe. I've found that sometimes less is more at these visits. It's just sort of a learning thing for me, I think. But if we sort of focus on maybe 2 or 3 major important points and then just support the family, usually those visits end really well. So that's a newborn visit. There usually are no shots at that visit unless the baby did not get hepatitis B in the hospital. In that case, we will give their first hepatitis B at their first newborn visit. And usually it's about at maybe day 3 or 4, usually within 48 hours of being discharged, so whatever that is for your baby. That's when we like to see them in the office because sometimes things will surface at that point that were not picked up in the hospital. So plus the weight gain, feeding, and things like that we like to keep up on. So the next visit, as I mentioned, would be 2. Or 2 weeks, and the 2-week visit is pretty straightforward. It's really like a growth and development visit. Again, kind of conquering some concerns that the parents might have. After that, we have a 1-month visit, and that's going to be when you get your second hepatitis B if you're vaccinating, which most of our patients do. We don't usually expect much in the way of side effects from that vaccine. At a 1-month visit, we also will check to see that the baby is tracking the way that they should be. We also check to see if they're still stooling without issues. And we do a top to bottom check. There's not much going on. They like to eat, they like to sleep, and they like to poop, and that's pretty much it. Or maybe they don't like to sleep, I don't know. Depends on the baby. But, at a 4-week visit, oftentimes the question for us is, when are they going to sleep through the night? We hope that your babies will sleep through the night, or at least one stretch. By about 6 or 8 weeks, they may have like one longer stretch of like 5 or 6 hours. That's what our hope is. They won't be sleeping through the night for quite a few months. So, adding cereal to their bottle will not help that. Studies have been shown have been showing that there's no relationship to rice in the bottle and sleeping through the night. So it's a natural biological thing that they wake up through the night. If they didn't do that way back when, we wouldn't have survived as humans, so it's actually a good thing. And as exhausting as it might be, just keep in mind that it's not always going to be that way. It's a phase. They're going to get through it. They're going to grow, and they're going to be able to have a little bit more of a stretch. So 2 months, 4 months, and 6 months, those are shot visits. You end up getting a couple of different shots at those visits, one of which is oral if you're vaccinating. And The other parts of those visit, again, it's growth, it's development, it's questions, it's safety. Especially at the 6-month visit, we want to start to give them some safety information, give parents some safety information on baby-proofing your house, because by the time we see them at their 9-month visit, they are going to be moving. And sometimes, we want to anticipate that. They probably are rolling already at 6 months and getting to where they want to be, but not exactly crawling. So we know by 9 months that most babies will be, and so we want to also anticipate that and keep them safe, especially if there are other siblings in the house, because then you have Legos and Play-Doh and Barbie shoes and pens and pen caps and markers and crayons and all that. So kind of a challenge, but I think you just do the best you can. The next visit's 12 months. The 12-month and the 15-month visit, again, growth, development, nutrition, picky eating comes up a little bit later. Language development comes up a little bit later, usually at that 18-month visit. The 15-month visit's kind of fun. Usually it just kind of deals with concerns about what the child's doing as far as development. That's a lot of times the questions that we have. Are they talking? Are they walking? Some babies do this later, and that's okay. But it's nice to kind of check in with your pediatrician at the 15-month visit. The 18-month visit, again, we expect about a language explosion at this time, so we're looking for that. We do a couple of different things to check for development out of some of these visits, some screening tools. They're not diagnostic, they're just screening, so we know if we can catch some things and we need to refer them and get them some help. The 24-month visit is pretty straightforward, 2 years old, unless it's a flu shot that's due. We don't have any shots at that visit, or if they're playing catch up on something. The 30-month visit is actually the new one that they're adding, so that may be becoming pretty routine in the future. And at 30 months, you would want your baby to be putting 2 words together at that point, definitely running, and all of those things. So sometimes at this point, we start to talk about potty training, if appropriate. We start to talk about, transitioning from crib to bed. If you're lucky, your baby's still in a crib. They're easier to confine when they're in the crib. So if they're not vaulting out, keep them there as long as possible. The main thing is we want to create environments for the kids that create a sense of independence, a sense of curiosity, and allowing them to fulfill their curiosity. And so it's important, to snuggle your baby and hold your baby, but when they start to get to these developmental milestones where they can move, we have to let them, for the most part. As far as, crawling on the floor, rolling on the floor. A lot of mamas wear their baby, and, I did this as well, but we have to be mindful to also give them lots of floor time, lots of tummy time for their muscles to develop and their heads not to get flat. Some of these things, although common, can definitely hinder a baby's development. So that's that. And then we have, 3, 4, and 5. The biggest thing with those, 3-year-old, usually we're talking about discipline and temper tantrums, things like that. That can take up probably 2 visits, time-wise. But the 5-year-old visits, usually 4 or 5, you start to get your kindergarten shots. You see if they're kindergarten ready. You see if they know their colors and know prepositions and interact with you in a way that is socially normal for age. So that's up to about 5. I'm going to talk on a different block about adolescents, because that's sort of involved, in children in general, school-age children. So stay tuned for that one. Take care.